Okay, we're here the day of surgery with Maria, and I just want you to just tell me again what happened with the lower eyelids.
Okay, I had a fat transfer.
Mm-hmm.
My lower and didn't work, so I had to remove that. Dr. Sharma is gonna help me with that.
Thank you so much. What don't you like about what happened there?
I used to have, dark circles.
Yeah.
Now I have bags. I don't like to have
Okay,
bags.
so feel like we got some new bags after the surgery. And what I see is when I look at these and I feel here, and we talked about in the office, it's a little more firm than I would normally expect from eyelid fat. So I do think that some of it probably came from the fat transfer. What we're going to do today, like we talked about, was the invisible incision on the inside of the eye and just remove that extra fat. And this is the area of the extra fat. How much of it is palpebral or eyelid fat versus how much is from the fat transfer. There's no way we're going to know till we go in and really take it out, but that's where we are. Okay. Abre ella. Cierra los ojos. Good. You can open. Good. Should do it, love. Okay. So right now Maria's just headed off to go to sleep here with Dr. Mendoza at the helm. Went to sleep very well. Shortly we're going to get her positioned and start with the lower eyelid procedure. So we're just about to get started with Maria's procedures. Again, this is a revision procedure. And the thing with revision procedures is that you never really exactly know what you're going to get until you get in there. There's always can be some scar tissue and some distortion of the normal anatomy. The best way to deal with those things is using what you know from your knowledge of anatomy and your experience. I've done maybe 1,000 of these lower eyelid procedures, and a good number of those have been revisions. I like this approach with the invisible incision on the inside of the eye for revisions. I think it minimizes the risk of complications to the lower eyelid. But anyhow, so with revision surgery, you just kind of rely on your anatomy and your experience and do the best that you can, but you really don't know what you get until you get in there. So every procedure, like every patient, is different, and I'm confident that we'll get a good result for Maria today. Okay, so we're just about to get started with Maria's procedure again. We're working through the inside of the eye and so-called an invisible incision to remove these extra fat pockets that are here. Okay, and we're going to be taking those out to give a better contour for the eyelid. What we're doing now is placing the local anesthesia carefully within the eyelid. Local anesthesia serves two purposes here. The first is to reduce pain during the procedure. And then the second, mixed in with the local anesthesia, is epinephrine or adrenaline, which is a substance that sounds familiar to people because it's made in the body. This is exogenous adrenaline, or it comes from outside the body, made in the laboratory, and what it does is it reduces the amount of bleeding. Okay. And then the other thing that it does is it keeps the local anesthesia in this vicinity for longer. So instead of maybe an hour's worth of anesthesia, we're going to get, let's say, 2.5 hours worth of anesthesia. And today we're using an anesthetic called lidocaine. I like this approach to the eye because it's effectively incisionless. There's no outside incision. The other thing is I don't use a blade at all, so this is a bladeless procedure. And then finally, I don't put any stitches in. I haven't found the need for stitches in for this procedure. So effectively you have an invisible incision, you have no blade, no scalpel, and you have no stitches that need to be removed. So we're working in a way that she's asleep, okay, but it's safe because she's breathing on her own. She's not totally asleep. We miss all the potential complications of having a breathing tube put in, and she's not going to remember the procedure itself. Dr. Mendoza, I'm going to go ahead and make the incision.
Let's go ahead.
The key with incision placement for a lower eyelid procedure is you want to be careful to not disrupt the tear collecting apparatus of the eye. Okay, so tears are made essentially in the upper eyelid and they drain down into the nose from the lower eyelid. If you know your anatomy, you stay away from the drainage port for the lower eye, which we just did, and that allows us to proceed safely. I think people get the impression that a lot of plastic surgery, I don't know if this comes from Nip Tuck or just watching a lot of surgery on TV, that it's gory and it's a lot of blood loss and that sort of thing. You can see there's no blood in this field at all. You can also see that the instrument that I'm using is a cotton tip applicator. That's a doctor's fancy way of saying a Q-tip. And this really is the instrument that I use the most, or nearly the most, for this entire procedure. See, we're in the process of removing the fat pocket here. This is a central fat pocket, the one that's closest to the nose. It's coming out nicely. And that's just part of what we have to get done, so we're moving in the right direction. So if you look right here, it may be subtle, I don't know if it'll show up on camera, but we already have a reduction in the areas in which we wanted to remove the fat. Specifically from that central fat pocket that I was talking about, I need to do a little more in the medial pocket, and then we'll see right around here, but we're getting very close to the contour that we want for the lower eyelid. That last little touch of fat that we got, that's the perfect cosmetic result as far as I'm concerned. That looks very good. Some of this out here laterally that we were talking about, I think, is part of the cheek complex rather than the eyelid complex. It may very well be that we'll let the swelling go down and it'll be fine, or it might be that I have to take some other steps to address that spot. But in terms of the extra fat and the real fat pockets, those are really addressed very well for this eye. That's just about a perfect eyelid procedure. And you can see we just gently replace the eyelid to its normal anatomic position, no suture required, and we're going to be moving over onto the right side now. Okay. So what we're doing on this side, the right side, is what we did on the left side. We're looking for the lower eyelid fat pockets, keeping in mind our anatomy. We should be right on it. And these little fat pockets will be coming up here any minute. There's one there. And we're just going to remove that carefully. We're doing pretty well at getting this lateral fat out of here. That's the fat that's closer to the ear. Okay, the lateral fat pocket. We need to spend just a little bit of time more medially, closer to the nose, and then we'll be pretty close to done for the day. Again, this procedure is what we would call bladeless. There's no scalpel used here at all. This is a device that's in my right hand that uses electrical current. That's what I use here. There's no scalpel. You can see there's essentially no blood loss. Additionally, this incision is what I refer to as an invisible incision essentially because it's on the inside of the eyelid rather than on the outside. That's something most women and most men are concerned about, is incisions from plastic surgery. And finally, I don't use sutures for this particular procedure. So there you have it. You have essentially no incision, no cold steel blade, and you have no stitches that need to be removed. Okay, so we can see that the contour of the right side is significantly improved. Again, this was the area in which we were planning to remove fat, so this has become significantly improved from the convexity that it was. Okay, and I'm just going to look a little more here medially, which is close to the nose, but we're just about done, and I think we're coming up on about a half an hour procedure time, so everything's just going as smoothly as it can. We got a little more out here, just a little tiny drop there. I'm going to look for maybe it's either fat versus a little tiny bit of swelling. So we're going to take a look, but we're getting close to finishing up here. So effectively we're done. We just replaced the eyelid on the right side to its normal anatomic position like that on the left side. I'm happy with the amount of fat reduction we have for each lower eyelid. This one's starting to swell a little bit. You can see this one will shortly follow, so we'll put some cool compresses on. In terms of the cosmetic result, I think it's going to be fantastic. We had less than a teaspoon of blood loss. Our operative time was probably 40 to 45 minutes. And Maria here is going to have a very, very nice result. This is Dr. Sharma. We just finished our lower eyelid procedure for Maria. I think we're going to have a fantastic result. Everything looks great, went as planned. I suspect she's going to have about a week of downtime where she just takes it easy. Going into that second week, she should look great. There's no sutures to remove, as we talked about. And I think we addressed the areas of concern, the issues that were bothering her from her previous procedure. Again, no scalpel, no stitches, and an incision on the inside of the eye.